It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas-Fort Worth area that are helping to change people's lives.
This is the place to come to find the latest procedures and, of course, some of the best doctors. Like our first best doctor, it's Dr. Philip Swanson.
Before I went to see Dr. Swanson, I was 200 and something pounds. I had a 2-year-old little girl. I was on the sidelines a lot. You know, I was that big parent, not very healthy, not very active, and I wanted to participate more with her in her life and the things that were going on with her. She was 2, she was walking, running, and very active. So that's what drove me to go see Dr. Swanson.
The advantage of the sleeve is that when you remove that part of the stomach, you change the communication of your insides. People think of the stomach as just a bag to hold some food, and it makes some acid, and yeah, there it is. No, the stomach is an amazing organ. It manufactures several hundred chemicals that communicate to the pancreas and the liver and the brain and the fatty tissues. And all that communication goes on all the time. So when you remove part of the stomach, you change that communication, and that's when amazing things happen.
Within 2 weeks, 3 weeks of the surgery, I'd already had dramatic weight loss. To date, it's been a year from my surgery and I've lost 120 pounds. Life has changed dramatically. When I go to the doctor, my doctor is just floored at the progress that I've made.
People seem to have a place where they live as far as their weight. They've been 300 pounds for the past 10 years. Their stomach and their brain and their fatty tissue communicates and says, you need to live at 300. When you change that communication, on the day of surgery, their brain now thinks you should weigh 160. When your brain thinks you should be 160, and it's getting the signals from the fatty tissue saying, oh, we got all this extra reserve out here, the brain says, we got plenty of energy. We don't need to eat. And these people are not hungry. It's amazing.
If I hadn't had the surgery, I don't know what it would be like, to be honest. I mean, I wasn't there. I work out 3-4 times a week and it's not hard and it's easy now. And before it was just so hard, it hurt my knees, it just wasn't fun. And now I can go to the gym and I don't mind wearing the gym clothes and it's great. It's fantastic.
Prosthodontics is the name of the specialty, and it's one of 9 dental specialties recognized by the American Dental Association. It's a specialty that requires 3 years of additional training at a dental school level. It's 3 years dedicated to the specialty of prosthodontics, which is reconstructive dentistry, including dental implants, crowns and bridges, dentures and partials, some TMJ treatment, and other small areas of dental reconstruction that most people will never need. A typical patient that finds our practice has needs ranging from fillings all the way up to full mouth reconstruction. We handle everything in-house. By having everything in-house, we have total control of patient outcomes, and that's our main goal here, is to have fantastic outcomes. One of the biggest strengths of my practice is the amount of time we spend with each patient. It's all about education here. Every new patient is scheduled for 1 hour, and we go through their complete diagnosis, their treatment plan, and we attempt to educate them on all the options that are available. And it's one of the things that I enjoy the most about my practice, is getting to know the patient and helping them understand their problems, but also giving them several different options on how to fix their problems. We often have multiple try-ins so that we don't just make the patient look good, but we make them look fantastic because we've taken the time to pick the right tooth size, tooth shape, and tooth color that fits their complexion and their facial shape. Another way that my practice significantly departs from common implant treatment is that I do everything myself. I do the planning, I do the surgery, I do the teeth. It's all me and my hands fabricating these restorations for the patient. There's not a laboratory technician that comes in during the procedure, and no one else touches the patient's care except me. We're committed to patients having long-term success, so we do provide all phases of services, including cleanings and maintenance. Often I frustrate my patients because I'm so picky about their outcome that we sometimes have to make changes or we have to redo the restoration if I'm not satisfied with it. But it's important to me that we get it just right for every patient, whether it takes extra time or not.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
For more information on any of the outstanding doctors you've seen on today's show, just visit our website, bestdocsnetwork.com. And now let's check in with our next best doctor. It's Dr. Robert Wilcox.
Well, mommy makeover is a term that incorporates recontouring and improving the body, in particular after one or multiple pregnancies.
Over the past 6 years, I've lost a lot of weight and have had a baby and just had a lot of imperfections that I didn't like about myself that made staying healthy difficult.
What a mommy makeover incorporates is usually a tummy tuck, which tightens the muscles and the skin and removes the lower abdominal stretch marks. And oftentimes there may be loss of breast tissue from the pregnancy and subsequent nursing, or there may be drooping in addition, in which case breast augmentation or a breast lift or the combination of the two is done in conjunction with the tummy tuck. And then there may be need for liposuction as well in, for instance, the hips or the thighs.
My concern is I work. I'm a working mom, so I knew I couldn't take off several months after each procedure, so that was a big concern of mine. And I'm a respiratory therapist and I work 12-hour shifts on my feet, so I had to be able to be active when I came back to work. That was a big concern of mine. So Dr. Wilcox explained how he would divide up the mommy makeover that would best fit my schedule and my lifestyle. He definitely put me at ease over everything that would be done and what to expect after it was done and how it would look.
Looking in the mirror and not liking what you see, how more impersonal can that be? And now to look in the mirror and say, I not only look good, I look good for my husband. That's a knockout there.
Even going to buy a new pair of shorts or a sleeveless shirt. I used to wouldn't wear short sleeves or a sleeveless shirt, and it's just a freedom that you have to go think something's cute, try it on, and it does look cute. I am very pleased with the outcome and service that I got from Dr. Wilcox, and it is the best outcome that I ever could have thought.
I was very apprehensive about coming into preferred imaging. The night before, I had read every negative thing that could happen when you have an MRI. So when I came in the door, the secretary met me, just smiled. And the technician for the MRI was just really helpful, very reassuring. I was so happy I'd come to preferred imaging.
So I had saw a physician out of town, and he had looked at both MRIs and was wanting to order a different MRI. And he preferred the one for preferred imaging better than the other one and asked me would I return here for the one he was ordering. So we did, and he was very pleased with the second one that I had here as well.
The setting, the waiting room, and the changing room all were really nice.
Their room is really painted pretty neat. It's very artistic, and just kind of makes you feel like you're not in that normal cold hospital type feeling, just more of a warm type feeling.
The staff was uplifting and answered all my questions, and the procedure was so stress-free. The technician gave me a button to push if I needed help instead of wiggling my feet and trusting that somebody was going to see me. The first thing I did when I was inside the MRI machine was to test the button, and she immediately came and pulled me out and said, "What do you need? Is everything okay?" And I was like, "No, I'm just testing the button." And she was like, "Oh, that's okay. I just want you to know that I'm here and I'm watching you and you have the button." And so that was very reassuring. And then the procedure was just like they said. I had an absolutely fabulous experience at Preferred Imaging.
I also live 2 hours away, but I am in a small town, and the imaging there is mobile and it's not very well. So I do travel up 2 hours so that I can get good quality imaging. And so when the doctors like it and prefer it, it's worth the drive of 2 hours.
They're really friendly, really nice, very helpful. It was I really did have a good experience here.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
You know, Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, you know, over the age of 40, who a lot of times, you know, they take care of themselves, they stay in shape, they look great. But there's just some things they want to do to try to look younger. And for Sandy, you know, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him. And I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, and literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener. He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, "Wow, where'd you have your teeth done?" But they look at you and go, "Man, you look great. You know, what have you done? Have you been working out more? Or you just look." For some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, "Oh, what'd you do to your teeth?" you know.
My family would say, "Okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut?" I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
Don't forget, for the latest procedures performed by all the great doctors you see on today's show, you head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
It certainly is the place to get lots of information. And next, we're going to get some information from our next best doctor. He's plastic surgeon, Dr. Bruce Hermann.
I found a small lump on my left breast after I had my third boy. So I went in, had it checked out, didn't think anything big about it. After sonogram, mammogram, biopsies, it came up cancerous. So I found an oncologist, and they did chemo and then set me up with a surgeon for a double mastectomy. The surgeon introduced me to Dr. Hermann. I went to see him and we started working out our issues on what we were going to do.
When a patient has to have a mastectomy for breast cancer, oftentimes the surgeons that are doing the mastectomies will work together with a plastic surgeon to go straight from the mastectomy into a reconstruction in the same operation. So we oftentimes see the patient before they've ever been operated on, which is great. I think breast reconstruction works best when it's a team approach.
After the mastectomy, he came in and put spacers in and filled them with saline to kind of stretch the skin before they put the implants in. And when I came out, I had boobs. I came out, you know, with more than what I had expected. I thought it would be flat. When you hear mastectomy and reconstruction, you don't feel like you'll come out with anything, but I did. And I knew, right then, I knew I was on the right track.
Rachel is a great example of breast reconstruction. She is a young woman who unfortunately received a diagnosis of breast cancer at what I consider a very young age. We found a reconstruction method that fit her particular diagnosis and treatment plan the best. We did her operation for reconstruction the same day she had a mastectomy. Her reconstruction went very well, and now she has her breast back.
Today I am feeling wonderful. I think I'm pushing myself more, that I'm able to do anything I want to do. I feel beautiful and happy and thankful that he was my doctor. I feel like a new woman, a new Rachel.
We are here with one of the best doctors that specializes in the back and neck. He is a pain management specialist, a board-certified physician that treats problems with the back and neck. And some of your patients that come in, what are the most common symptoms?
Well, patients that come into my office often complain of neck pain that may or may not be associated with arm pain, numbness, or tingling, or shoulder pain, numbness, or tingling. They also might be complaining of thoracic or mid-back pain that may or not be associated with numbness, tingling, or pain radiating around to the ribs. Most commonly, they come in complaining of low back pain that may or may not be associated with leg pain, numbness, or tingling, or otherwise known as sciatica. What we find out is, upon evaluation of these patients, that this procedure addresses these conditions such as a herniated disc, a bulging disc, scar tissue that might be in the spine from trauma, or even patients that have already had a surgery on their back and or a fusion of their back that still can be treated with this minimally invasive procedure.
Dr. Williams is one of the only specialists in the world that does a minimally invasive procedure that can detect and treat neck and back problems. Explain this procedure.
What I do is I make a very small 2 to 3 millimeter incision in a natural opening above the patient's tailbone without damaging any bone. It also has a laser, a state-of-the-art laser, and a high-definition camera that I can drive up to the patient's, into the patient's spinal canal and examine the patient's spine for herniated disc, bulging disc, scar tissue, inflammation, and then treat that patient's pain or a condition right there.
All right, Dr. Williams, so I have the procedure on my back or neck. What about the recovery time? How long?
Well, I'm glad you asked that, Jim. Since it's such a minimally invasive procedure and an outpatient procedure also, I usually can have a patient back at their desk job or office job the next week after they have the procedure.
All right, there he is, Dr. Jason Williams, the go-to doctor when it comes to back and neck problems. All right, thank you, doctor.
Thank you so much, Jim.
There's two main types of arthritis. There's osteoarthritis and there's rheumatoid arthritis. Osteoarthritis is common, rheumatoid arthritis is not. Osteoarthritis is mild to moderate. Rheumatoid arthritis can be a very bad disease. And how do you tell the difference? Well, osteoarthritis is usually wear and tear of weight-bearing joints like the knees, or joints in your hands, the ones that move a lot, like this one right at the base of your thumb. Rheumatoid arthritis involves usually the knuckle joints. It can involve a lot of other different joints, but those are the main ones where they start. And it starts with stiffness in the morning. Now, osteoarthritis results in 15 to 20 minutes of stiffness in the morning. Usually goes away once you get up and move around and sort of oil your joints up a little bit. Rheumatoid arthritis results in sometimes 2 to 3 hours of stiffness. So if you have a lot of stiffness that lasts a long time in the morning, that generally could be rheumatoid arthritis. Again, it's a rarer illness than osteoarthritis, but it's also much worse, and there's a lot that can be done to make it improve and not progress and cause crippling deformities.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab. For those suffering from skin cancer due to that hot Texas sun, our next best doctor can help you out. It's Mohs Surgeon Dr. Patrick Walsh.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that we're removed so that we're sure that we've gotten all of the skin cancer.
The first time I had any problem was out in California. And I had some work done in here. But the doctor told me, he says it might come back because they didn't have the Mohs system at that time. Then I had this one.
Mr. Wattier presented with a recurrent squamous cell carcinoma involving the right posterior auricular area. The posterior auricular area is the area behind the ear and extends onto the anterior portion of the scalp and the upper portion of the neck. It also involved the posterior aspect of the right earlobe. During Mohs surgery, we were able to get a clear margin. I believe it took 3 stages of Mohs surgery before we had clear margins. The resulting wound was approximately 3.5 centimeters long by 2.5 centimeters wide. What we did was come up with an advancement flap that required removal of Burroughs triangles, small little triangles of tissue at the superior and inferior edge of the wound. We then undermined the tissue, advanced it to the edge of the posterior auricular sulcus, sutured that in place, and then used one of the Burroughs triangles that were excised as a skin graft for the defect on the posterior aspect of the right earlobe.
See, he had to do a little patch in there. See, the ears aren't the same. I lost part of my ear here. It's healing up a lot better than I thought.
So he's now 4 months post-op. All of the sutured areas have healed very nicely. The skin graft took very nicely, and everything looks perfect.
These make you feel relaxed all the time. It really is nice.
Before I met Dr. Troum, my quality of life had gone downhill due to the carpal tunnel syndrome. I was unable to even get a good night's sleep. My passion is dogs, and I was unable to feel comfortable doing the thing that I love with the dogs, and they're show dogs, so we have a lot of grooming and drummeling with their nails, and my husband had to do all of that because I was unable to do it.
The typical symptoms are patients report having classically numbness and tingling in their hand. Frequently it wakes them up at night. They can have pain as well. Sometimes it's a mixture of the two.
Even loading the dogs in a crate and driving them to the shows became something kind of scary before I had the surgery done.
Your median nerve, which crosses your wrist at your carpal tunnel, is under pressure. It's being squashed. So it goes to sleep, just like your leg going to sleep when you sit too long. The treatments are designed to try and take pressure off of the nerve. Initially, we try to do that conservatively with splinting, steroid injections, an anti-inflammatory medication. If that doesn't work, or if the carpal tunnel syndrome is really bad, then we do offer surgery, which serves to decompress the nerve.
I was really looking for a pain-free solution and a permanent solution to get rid of this problem. So he described what would happen, that he would make 2 incisions. I would have a small dressing. It would be done on an outpatient basis. Then the thing that I had to do was go home and make sure that I followed all the directions that he gave me, which I did to a T.
You can see that there's actually a groove that it's made by the bone. In the carpal tunnel, the walls and the floor are all bone. But what makes the ceiling of the carpal tunnel is this rubbery ligament that sits on top. And it's that ligament that we cut to splay apart and take the pressure off of the nerve.
I am so grateful to Dr. Troum for the pain freedom that I have gotten from this surgery. It has truly given me my quality of life back.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
Miss Skiles is a able to drive, able to walk. She's doing a lot better compared to before. She's very satisfied with her care.
I'm very comfortable with Dr. Farhat because I think that we both are working towards the eventual goal of pain freedom. I respect him as a doctor and I appreciate his hands-on human touch.
I can say that we achieved pain freedom in regards to her leg pain. She's still having achiness on and off in her lower back when she's active and at work, but for that she takes only an anti-inflammatory medication and occasionally a pain pill. Overall, she's very satisfied with her care and the pain relief we provided for her.
He gets that I can't just lay back and wait for things to heal, that we're going to work together to be completely healed at some point.
As a pain management specialist, my goal is to achieve pain freedom on any patient we see and treat.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas-Fort Worth area that are helping to change people's lives.
Don't forget, for those who want more information about any of these outstanding doctors and the latest procedures you've seen on today's show, you can do it. You can find the information out on the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
And if you have a question or a comment for us, or if you know of a doctor that's helped change your life, send us an email, info@bestdocsnetwork.com.
So long, everyone. We will see you next week.